Dr. Becker, after age 65, one of the most dangerous threats to your heart, your liver, and even your brain may not be the fat you can see in the mirror. Serious. It may be the fat hiding deep inside your abdomen, wrapped around your organs, quietly driving inflammation, blood sugar problems, fatty liver changes, and damage to your blood vessels. And here is the part most people never hear. You can look only slightly overweight, or even fairly normal for your age, and still carry enough visceral fat to put your health at risk. Research from Mayo Clinic, the American Heart Association, and NIH-backed sources supports that hidden abdominal fat is linked to higher risk for cardiovascular and metabolic disease, even beyond what BMI alone can show. Surprised? Most people think the real danger after 65 is simply getting heavier, but that is not the full story. The deeper problem is where the fat is stored, what that fat is doing biologically, and what happens when it rises at the same time. Muscle starts to fall. Thoughtful. That combination can quietly change the way your body handles sugar, fats, inflammation, energy, and repair. And that is why two people can weigh almost the same, wear the same size clothes, and have completely different futures when it comes to heart disease, fatty liver, memory decline, and loss of independence. So in this video, I want to show you what visceral fat really is, why it becomes more dangerous after 65, how it may damage your heart, your liver, and your brain, and most importantly, what you can start doing now to reduce it before it steals years of healthy life. Let's start with the hidden truth. Not all body fat behaves the same way. The fat just under your skin is called subcutaneous fat. That is the fat you can pinch. Visceral fat is different. It sits deeper in the abdomen, surrounding organs like the liver, pancreas, and intestines. And unlike the fat you can grab with your hand, visceral fat is metabolically active. In plain English, that means it is not just sitting there. It is sending signals. It is releasing inflammatory chemicals. It is changing hormone patterns. It is influencing how your body responds to insulin, how your liver processes fat, and how your blood vessels function. Mayo Clinic describes belly fat, especially visceral fat, as much more than a cosmetic issue because it is associated with serious health risks. And this is where it gets more important after 65. As we age, many adults naturally lose muscle mass and gain more fat in the abdominal region, even if body weight does not change dramatically. So the scale may stay fairly stable while the body becomes metabolically more fragile. Muscle is one of your most protective tissues. It helps absorb blood sugar, supports insulin sensitivity, maintains strength, and keeps metabolism more resilient. When muscle shrinks and visceral fat grows, the body becomes easier to inflame, easier to exhaust, and harder to regulate. That is one reason older adults can develop diabetes, fatty liver, or cardiovascular disease without what they think of as major weight gain. Now let's talk about the heart first, because this is where hidden visceral fat becomes especially dangerous. Your heart is not damaged by one single event. In most people, damage builds quietly. It starts with irritation inside the blood vessels. The lining of your arteries, called the endothelium, is supposed to help vessels relax, control blood flow, and resist plaque formation. But visceral fat can interfere with that system. It releases inflammatory messengers and contributes to abnormal blood fats, insulin resistance, and higher blood pressure. Over time, that can create the perfect environment for plaque buildup, vessel stiffness, and reduced circulation. NHLBI explains that abdominal fat is deeply tied to the cluster of problems seen in metabolic syndrome, including high blood pressure, unhealthy cholesterol patterns, insulin resistance, and cardiovascular risk. Here is what makes that so deceptive. Many older adults assume that if their overall weight is not extreme, then their heart risk is probably acceptable. But abdominal obesity can raise cardiovascular risk even when BMI does not fully capture the danger. The American Heart Association has highlighted that more belly fat is linked to heart disease risk even when body mass index does not indicate classic obesity. So the warning sign is not always total size. Sometimes it is distribution. Sometimes it is the waistline. Sometimes it is the blood work that slowly worsens while the person still says, "I don't think I'm really overweight." And the reason this matters so much after 65 is that the cardiovascular system is already dealing with age-related wear. Blood vessels become less flexible. Recovery becomes slower. Physical activity often declines. Sleep may become more fragmented. If visceral fat is added on top of that, it is like pouring fuel on a slow-burning fire. But the heart is only part of the story. The liver may be taking some of the biggest hits, and most people do not feel it happening. Your liver is a metabolic control center. It processes nutrients, helps regulate blood sugar, packages fats, detoxifies compounds, and supports energy balance across the whole body. But when visceral fat rises, excess fatty acids and inflammatory signals begin spilling into circulation and interacting directly with the liver. Some experts describe this as crosstalk between fat tissue and the liver. A more vivid way to think about it is this. Visceral fat starts sending metabolic traffic straight into one of your body's busiest processing plants, and eventually, that plant gets overloaded. At first, there may be no symptoms at all. That is why this is so important. A person can be walking around with fatty changes in the liver, rising triglycerides, worsening insulin resistance, and chronic inflammation without pain, without dramatic warning signs, and without realizing anything is wrong. But inside the body, the system is getting more congested. Fat begins accumulating in liver cells, inflammation may rise, blood sugar regulation worsens, and once the liver becomes less efficient, the rest of the body feels it too. Energy may drop, hunger patterns may become more unstable, blood lipids can worsen, and the cycle feeds itself. This is one reason visceral fat is so biologically dangerous. It does not stay in one lane, it spills into everything. And now we get to the part that many viewers will find the most surprising. The brain may also be affected. Now I want to be very careful here, because this is an area where the evidence is important, but should be framed responsibly. Visceral fat does not mean someone is destined to develop dementia. It does not prove that memory loss will happen. But research supported by the National Institute on Aging and reporting from major academic health sources has linked excess abdominal or visceral fat with early Alzheimer's-related markers and higher dementia risk. In other words, this may be one more signal that unhealthy metabolic aging and unhealthy brain aging are connected. Why might that happen? Because the brain depends on steady blood flow, stable energy delivery, low unnecessary inflammation, and healthy insulin signaling. And visceral fat works against all four. It promotes chronic low-grade inflammation. It can worsen blood vessel health, which may reduce the efficiency of circulation. It can intensify insulin resistance. And insulin is not just about blood sugar. Insulin signaling also matters in the brain, and it often travels with poor sleep, inactivity, and fatty liver changes, which together create a much more hostile environment for cognitive resilience. So when I say hidden visceral fat can affect the brain, I am not making a scare statement. I am pointing to a broader biological pattern. The same internal conditions that strain the heart and overload the liver may also make the brain more vulnerable over time. But here is where most people make the next mistake. They hear all of this and think, fine, I just need to lose weight fast. Not so fast. After 65, the goal is not simply to get lighter. The goal is to get metabolically healthier while protecting muscle. And that distinction changes everything. Because if an older adult uses aggressive dieting, skips protein, becomes less active, or loses weight too quickly, they may lose muscle right along with fat. And muscle loss after 65 is not a minor issue. It can mean weaker legs, poorer balance, lower insulin sensitivity, slower metabolism, less independence, and more frailty. Recent literature on older adults emphasizes that visceral obesity becomes especially problematic when it coexists with sarcopenia, the age-related loss of muscle and strength. So the real objective is not eat less and hope for the best. The real objective is this: reduce visceral fat while preserving and ideally rebuilding muscle. That is the move. That is the intervention that makes the rest of this story start to turn in your favor. So what should you do? Here is the first step, and it is more powerful than many people realize. Start measuring risk more honestly. That means stop relying only on the scale. Look at waist size. Look at fasting blood sugar or A1C if your clinician has checked it. Look at triglycerides. Look at blood pressure. Look at whether you have been told you have fatty liver, prediabetes, or low muscle mass. Mayo Clinic notes that waist circumference is one useful way to estimate risk from abdominal fat, with commonly used adult cutoffs of more than 40 inches in men and more than 35 inches in women associated with greater health risk, although individual context still matters. That one step matters because what gets measured gets addressed. And now for the most important part of this entire video. If you want to go after visceral fat before it does more damage, the strongest evidence-based strategy is not a detox, not a miracle supplement, not a starvation diet, and not endless ab exercises. It is a combination of consistent aerobic movement, resistance training, and a minimally processed eating pattern that helps calm insulin spikes, reduce excess calories, support the liver, and preserve muscle. Let's break that down. First, walking and aerobic activity. Older adults often underestimate how powerful regular moderate movement can be. You do not need punishing workouts to start improving visceral fat biology. You need consistency. The National Institute on Aging recommends that older adults aim for about 150 minutes of moderate intensity aerobic activity each week, along with muscle strengthening activities at least 2 days a week, adjusted for individual ability and medical status. That could look like a brisk 30-minute walk 5 days a week. It could be cycling, swimming, or even multiple shorter walks spread through the day. The point is to create a repeated signal that tells the body to burn fuel more efficiently, improve insulin sensitivity, and reduce metabolic congestion. And this is where it gets deeper. Walking does more than burn calories. It helps muscles pull sugar out of the bloodstream. It improves circulation. It can reduce post-meal glucose surges. It may lower inflammatory tone over time. And for many adults over 65, it is realistic enough to maintain, which matters more than any perfect plan done for 1 week and abandoned the next. But walking alone is not the full answer. Resistance training may be the missing piece that changes everything after 65. Because if you only try to shrink fat without rebuilding muscle, you are leaving one of your greatest protective organs underdeveloped. Muscle is where a lot of glucose disposal happens. It is where strength, mobility, posture, and stability are maintained. It supports metabolic flexibility, which means the ability to switch between fuels and manage energy more smoothly. When you challenge muscles with resistance, whether through bands, weights, machines, or bodyweight exercises, you send a message to the body: keep this tissue, feed this tissue, preserve this function. That matters enormously in older adults. Even 2 or 3 well-structured strength sessions a week can help support muscle retention and healthier aging when done safely and progressively. And when resistance training is combined with aerobic activity, the evidence suggests the effect on visceral fat and metabolic health becomes more meaningful than either strategy alone. Now let's talk about food, because this is where people often either overcomplicate things or chase the wrong answer. The goal is not perfection. The goal is to create an eating pattern that makes it harder for visceral fat to keep growing. That usually means reducing ultra-processed foods, sugary drinks, excess alcohol, and the kind of frequent overeating that keeps insulin high and the liver overloaded. It means building meals around protein, fiber, healthy fats, and minimally processed carbohydrates in portions your body can actually handle. Mediterranean-style eating patterns are often recommended because they emphasize vegetables, beans, fish, olive oil, nuts, fruit, and less processed food overall. And research has linked these patterns with better metabolic health and reductions in harmful abdominal fat, especially when paired with physical activity. But the real reason this matters goes deeper. Protein becomes especially important after 65. Why? Because when older adults undereat protein, they make it easier to lose muscle during any attempt at weight reduction. And once muscle declines, blood sugar handling usually worsens, weakness increases, and healthy aging gets harder. So if you are trying to reduce waist size, do not do it with toast and coffee all day and a tiny salad at night. That is not a strategy. That is a setup for frailty. Think in terms of protein at meals, vegetables most days, fewer liquid calories, fewer processed snacks, and less mindless evening eating. Not because this is trendy, because it directly changes the hormonal and metabolic environment that allows visceral fat to thrive. There is also one more factor that people overlook: sleep. Poor sleep can worsen appetite regulation, insulin sensitivity, stress hormones, and energy balance. And when people are tired, they move less, snack more, and recover worse. So while sleep alone will not melt visceral fat, inadequate sleep can quietly make every other strategy less effective. That is why the best visceral fat plan is not one single trick. It is a system. Move more. Strength train. Eat in a way that protects muscle and reduces metabolic overload. Sleep well enough for the body to repair. And now here is the strongest insight of all. Do not wait for a dramatic diagnosis before taking this seriously. Do not wait until the fatty liver scan is worse. Do not wait until the blood sugar crosses into diabetes. Do not wait until your stamina is gone. Do not wait until memory changes make you wish you had acted earlier. Because visceral fat often does its damage quietly. That is why it is so dangerous. And that is also why acting early works. Even modest reductions in abdominal fat, along with improvements in strength, blood sugar control, and daily movement, can shift the internal biology in a better direction. The goal is not to become 25 again. The goal is to make your body less inflamed, less congested, more insulin sensitive, more mobile, and more resilient for the years ahead. That is a meaningful win at any age. So here's what I want you to remember. After 65, hidden visceral fat is not just a cosmetic concern. It may behave like an inflammatory organ. It may increase stress on the heart. It may overload the liver. It may contribute to a metabolic environment that is harder on the brain. And the most effective response is not panic and not crash dieting. It is targeted action. Measure your waist, walk consistently, build muscle with resistance training, eat in a way that lowers metabolic strain and protects muscle, and talk with your clinician if you have diabetes, fatty liver, heart disease, mobility limitations, or take medications that could be affected by major lifestyle changes. Because it is not too late, but it is time. If this message helped you, I want you to leave a comment and tell me which step you are starting with first, measuring your waist, walking every day, or adding strength training twice a week. And if you know someone over 65 who thinks belly fat is just part of aging and nothing to worry about, share this video with them. Subscribe for more evidence-based healthy aging guidance with Dr. Becker, and I will see you in the next one.